So there's a simple answer and a more complicated answer. The simple answer is it is much more common in the heterosexual community, so it's about twice the rate. And that's pretty consistent in Australia and in lots of other countries in the world. The more complicated answer is if we think about the L and the G and the B and the T and the I and the Q, we don't necessarily have great data for all of those subgroups. I think the impact of smoking on LGBTIQ people is exactly the same as it is on the rest of the population, except probably for two groups. So for trans and gender diverse people, there are some issues around the way that smoking might interfere with hormones, and the same thing for intersex people. We know that there's also some complications in terms of hormones and the effects of tobacco. So the same kinds of health issues in general. I also think one of the particular things about LGBTQI people is the idea that sometimes they're more concerned about accessing healthcare because they're expecting or they've experienced discrimination from practitioners in the past. And we also know there's some evidence that GPs don't necessarily raise smoking with LGBTQI people as often as they do with heterosexual people. So it might mean that those kinds of issues aren't coming up, so people might, their smoking might be going on longer than it could do because nobody's raising quitting as an option. In terms of what we need to do about smoking, I think the first issue is actually just to raise awareness that smoking is an LGBTQI problem. It's a health issue for those communities. I don't think that that's had much visibility, although we've had evidence of that in the research data for at least 20 years. I think the second thing really is going to be about partnerships, and that's about community organisations working with tobacco control organisations and really looking at co-design for campaigns and health interventions. We have a bit of evidence about what works in terms of anti-smoking interventions, and so we need to bring that evidence to community so that we can work together on that.